Hi, Dr. Art Ando, physical therapist, and we're doing doing a demo of the treatments that we're doing on our wonderful patient, Jackie Price, excellent dancer with a little bit of a foot problem, and so we've already done a little bit of taking off of this old callus using a Dremel tool, and so it's now relatively soft. Maybe she'll have to do that in a few months. And then the other thing that we're working on is getting the line of the foot better, such that it had this nice line curving across the top. And you like that line?
Yes,
okay.
I do.
And then this line you didn't like as much because it was more kind of like had that little bit of a saddle. And so what we're trying to do is get the line better, which there you go. And we're about halfway there, getting much better. One problem is that we had a first toe. And some of these joints through here were actually getting pretty rigid, which was causing a bit of a bump on the top of her foot. And so how we were reducing that is, where'd all my little toys go? These are called gliders, which are tools that I make especially for working with soft tissues and joints. And we place one underneath like this to help get the line of the foot back. And then we use other ones to help us to move the tissues, the capsules, the muscles, the tendons, so that they actually support this new position. So sometimes we can use them in isolation, sometimes we use them in combination to move the bones and the tissues at the same time. Does that hurt when I do that?
It's a little tender.
A little tender. And then if I did this on this foot, the better foot, what do you think about that?
Feels fine.
Feels fine. So when we have working on tissues that do need treatment, it tends to be a little bit more tender. We try not to make people regret that they have therapy, though, right? So we are always nice to them. Okay. So with that motion and with that loosening the soft tissue, then we can also do some hands-on joint tissue mobilization like this. Oh, heard a little click in there as the joint starts to loosen. Did that hurt or no?
No.
Okay, you felt it kind of move a little bit?
Yeah.
Okay, and you are, she's also has access to some of these tools at home so that she can stand and doing them on your own.
Yes.
That's good. And then what have you noticed regarding the treatment? How's your foot been feeling?
It feels a lot more flexible, and I can, when I walk even, I can get it flat on the ground rather than having it roll out. And while I'm dancing, I feel a lot more strength when I'm jumping, pushing off of the floor, and when I'm in my releve and on point, I can get more flexibility and over more in my foot.
Okay, good, because for a while there you were overbalancing to the outside.
Yes.
And that would decrease your endurance, and also just the whole look of the releves would change.
Yes.
And become less stable, and choreographers don't like that when you can't hold that position.
No.
Right? Okay, so thank you. You've been a wonderful subject, and hopefully this was an informative video from Ando and Aston Physical Wellness Therapy.